So this is Health of the Nations. Health of the Nation. It may have been sold to you as like a introduction to public health, but I've taken public health classes and I'm not doing that. Real public health classes is all about math, statistics, spreadsheets, lots and lots of Word document, Word editor. We're not doing that. So this is, you cannot tell people you're taking a public health class. Instead, I like to call this a public health concepts, so that if you ever do show up for an actual legitimate public health class, you don't have a dumb look on your face. The phrases, the terms will be familiar, and your mind will be primed and ready to dig into the math when you get out there. That also means that if everything you hear this semester sounds really interesting and exciting to you, and you think, yeah, I want to be a public health official, well, I'm just telling you now, it's going to be a lot of math, especially statistics, probability out there. Just fair warning. Okay, so public health is the efforts by people in authority to try to improve well-being for their citizens. And it's a coordinated effort to get the most benefit out of the limited budget and the limited resources they have. And there have been different kinds of approaches over in the history. Now, if you're listening to what I just said and you're wondering, where is this on the slide? He's saying something and I'm reading something else and they're not matching. So what's going on is I do not read slides to the class. Whenever I'm a student and the teacher shows up and turns his back to the audience and starts reading from a wall of text, that makes me upset. Because I'm thinking, I could have stayed at home and done this on my own. And here I had to drag my ass to school just so you can read it to me like I'm some kind of grade schooler. So I don't do that. I leave this, you can download the slides for yourself. I will make an extra effort this semester to make sure the slides are up several days in advance. You can read them for yourself. I'm just here to give highlights, to give extra commentary on what's already up there. So there have been efforts by people in authority to try to make life better for the citizens and overall. Absolutely limited by the levels of technology and communication. You know, in ancient times, there's only so much that an emperor of Rome or the chieftain of a village can do, right? But as technology gets better, as science gets better, then finally they can do more and more. For example, before the 1800s, there was the most common cause of death was infection. What about war? What about genocide? What about the flood? Didn't those kill more people? No. The most people in war died from infections from wounds. So you go off into battle, the other guy stabs you, but you survive that and you run away. But now that stab has put germs inside your body that will fester and grow. And since this was before the times of antibiotics, then there was either your body fought off the infectious disease or it didn't. And if it didn't, then you were SOL. And even making it to a hospital, and I'm using air quotes here, hospital to a doctor 1,000 years ago, didn't really guarantee you will be okay. Because before the germ theory of disease, doctors would not even bother washing their hands. Their arms would be elbow deep in somebody else's guts, and then they would turn to you and say, all right, let's see what's wrong with you. And then they would touch you all over, stick their arms into your body, elbow deep. And as far as they were concerned, it's okay. Because they didn't know that there were creepy crawlies smaller than the naked eye could see that is causing all this damage. So most people died of infections before the 1800s. Then during the 1800s, shortly after the Renaissance, people finally invented the microscope, and they had a close look at even our drinking water. Something we assumed that our drinking water, as long as it was clear and tasted okay, then it must be okay. But somebody took a really close look with a microscope and saw like an entire ecosystem crawling, swimming, eating, pooping right into that water. And they realized, oh my God, these things we're putting in our bodies, we're putting in our wounds. And you know what? Maybe doctors should wash their hands. And then once they become aware that there were these life forms in there, then now they knew that we need to find a way to kill it. And then antibiotics was developed or understood. I think somebody invented the first antibiotic, but they just used it and didn't know how it worked. But finally, with the germ theory of disease accelerated by microscopes, then they finally found out how antibiotics actually worked, which means now they can invent different kinds of antibiotics. And gradually, by modern times, infection started dropping down the list of most common causes of death. Eventually, it fell off the top 5. Nowadays, infection doesn't even make it to the top 5. 2 years ago, it creeped up because of which infection? COVID, right. But eventually, COVID will switch from an epidemic to an endemic. What's an endemic? Well, I will explain that in 2 weeks. And it'll fall down to around where influenza is, and it will fall off the top 5 killers again. So what is the leading killer of people today? And not just Americans, but people all over the world. Heart disease. What? Cardiovascular disease, yes. So that's a fancy word. I was just using the plain English version. For this week, heart disease. And what's going on is, as infections and accidents kill less and less people, more and more are surviving long enough for bad decisions to finally catch up to them. You can smoke like a chimney. You can eat all the ice cream cake you want. You can live la vida loca. And it doesn't matter, because if you're going to die from infection when you're 25, then you won't notice any of these bad decisions having effects. But now that you can live to 60, to 70, to 80, now these little damages that all of these bad decisions are having on your body finally do have a chance to catch up to you. Smoking eventually leads to cancer. Not caring about what you eat and how well you exercise allows the genetic predisposition for diabetes to actually matter. If you had the genetic code for diabetes, but you never lived past 30 because you and your group were like professional mercenaries, then it didn't matter. But now that you can live to your 60s and 70s, and now your eating choices over the past 40 years do matter, and you could suffer all the consequences of diabetes. If you don't care about nitrates and sodium, and yes, sodium does cause a problem, despite what you've heard on YouTube, and we'll cover that next week, then blood pressure will be an issue. And again, if you don't survive, if your life expectancy was in the 40s, it didn't matter. But now that you're able to live to your 70s and 80s, all of that constant pounding against your organs, the strain on your heart, finally wears the heart down, and that's cardiovascular disease. So what's killing most people nowadays, not just Americans, is cardiovascular disease, closely followed by the complications of uncontrolled diabetes, and then cancers. So we will focus on those diseases for the rest of this semester. Oh, did I say nutrition is next week? Sorry, I'm confusing with another class. We'll get to nutrition and food eventually, but not next week. So life expectancy was in the 40s in ancient times because of infectious disease, but now they're in the 70s today, in the late 70s today. It was a little bit higher, but it dropped. Lower infant mortality, which is more profound than just the straight number. Oh, infant means living up to the first year of life, 365 days. Mortality is the rate of death. It used to be that just by being born is not a guarantee of survival. Many children didn't make it past their first year of age, and of the remainder, many didn't make it past childhood. few actually made it to adulthood, which stimulated families to have as many children as possible to improve the chances that at least one makes it to adulthood and then can turn around and take care of their parents. Well, now that infant mortality has dropped by a lot, that's inspiring many families to not have as many children, which has massive, profound sociologic and political effects on society, and we'll talk about that too. So if we're less and less focusing on survivability, because now as people are able to get older and older, they're actually coming up against a hard line now, which is senescence. Our cells seem to be pre-programmed to stop working after a certain age, possibly 100 years old, maybe 110 years old. As we're coming closer and closer to that number, that our scientists have still not yet broken through. Maybe they will someday, but still not yet. Then we're now able to turn around and focus on the quality of life, not just the quantity of life. So reducing pain and suffering, improving the reasons to be alive, not just simple survival. Reducing debility, which is living with a disease. Okay. So public health efforts trying to, looking for patterns in disease and seeing if there's somewhere we can cut it off, or where can we be the most efficient at reducing disability, debility, and even death rates from it. And sometimes it actually works, and here are the achievements. Vaccination absolutely works. Despite what your favorite conspiracy theorists say, vaccination absolutely works. If for everybody you've heard of who got vaccinated and got sick anyway, for everybody you heard of that didn't get vaccinated and didn't get sick anyway, those are the minority, those are the exception. And the majority of people out there benefited from their vaccinations. Motor vehicle safety, because it's about health, especially the seatbelts. I was a child during the seatbelt wars, when scientists tried to prove that seatbelts saved lives, that automobile manufacturers tried to prove that it doesn't, because puts extra cost on the vehicle, reducing their profits, and they went back and forth, and automobile manufacturers tried to make their own research just to confuse people, just to confuse the other research in order to make people second guess themselves. The automobile manufacturers, they don't have to prove that seatbelts don't save lives. All they have to do is cause people who casually look for research on this to get confused. As long as they make the reader say, I don't know what to believe anymore, they've done their job. Because the research on seatbelt safety was so compelling that they had to do something to protect their profits. But finally, thankfully, automobile manufacturers lost. The laws were passed that all cars must wear seatbelts, and people finally stopped flying through the windshield on a head-on collision. Yes, seatbelts cause bruise. Oh, horrible, they cause bruise, shoulder bruise. And every time somebody says, look, this person got a shoulder bruise from a car accident, I would say, look, his head is still on. Priorities, right? We all got to have priorities, right? So seatbelts, massive win for public health efforts, and lots of other things here. Fluoride in the water saves you from having as many calories as you would have, cavities as you would have. If you Google for fluoride, you will absolutely run into websites that says fluoride is bad for you. Fluoride is bad for you in large amounts. In trace amounts, it protects the enamel of your teeth, and you've been to the dentist a lot fewer times than you would have if they didn't fluoridate the drinking water. Same with chlorine in the tap water too. Family planning, so that people who want to get pregnant do more often than not, and people who don't want to get pregnant don't, which then can have beneficial effects on the rates of abortion. The less people who get pregnant by accident results in less people wanting to get abortion after all. Tobacco. So if you take all of the lessons from the motor vehicle strategies and you apply the same rule book or playbook to the tobacco companies, you'll see a pattern. You'll recognize the same pattern here. That's basically what happened. When research came out that tobacco was causing lung cancer, the tobacco companies said, what do we do? What do we do? And their lawyers said, this reminds me of the seatbelt wars. And so that's what they did, trying to publish research, muddying the waters, confusing people, trying to trick them into thinking, I don't know. Make them say, I don't know what to believe, which allowed them to keep on smoking. Well, eventually they lost, and so now everybody accepts that tobacco smoking and tobacco causes cancer. Well, are we seeing the same playbook used by a different industry? Yes. Can anybody guess? Just a few seconds to think about it. Where else is a company facing a threat to their profits using confusing research, publishing research intended to confuse the scientific consensus to hold back any attempts at progress to improve public health? And you're going to hear me harp on this again and again, the sugar industry. Sugar is the new tobacco. Google for sugar is the new tobacco, and that is today's current challenge. So Google for any more of these, and you will see it for yourself. I should move on. Okay. So those who are actual successes. Now the vaccine is kind of maybe it's too big of a category, because there are some vaccinations that are not as successful as others because of public resistance. For example, we thought we wiped out measles from the world, at least from the United States. We almost wiped out measles from the United States. But thanks to certain groups, measles is roaring back. Last week, there was just a week and a month ago, there was news articles about a new measles outbreak. Some kid had measles, and they went to the airport anyway, and then it spread throughout the country. So measles is coming back, and I know, yes, everybody, ask your grandparents and they will tell you a story of how they got measles and they're okay, so it's not a big deal. What's happening is, since measles doesn't kill everybody, lots of people survive, and the ones who are debilitated, like permanent lifelong debility or even death, they're not heard about. They disappear inside the hospital system, and so the local community doesn't hear about it. And that's why the people who are okay go on thinking measles is not a big deal, because the death and permanent disability is hidden from the public. Lifestyle diseases is the big one, because heart disease is the big killer, and what causes heart disease? High blood pressure mainly, and also high cholesterol causing buildup in the arteries. And what causes that? Well, that's what I call the disease of easy living, which is exercise not enough, eat too much, and use tobacco products, resulting in high blood pressure, uncontrolled high blood pressure, uncontrolled diabetes, and cancer. Affordability and delivery and access of health care. Big problem here. Even with Obamacare, which is the attempt to make health insurance affordable, people are still getting medical bills that are wiping them out, driving them into bankruptcy. Environmental problems, I guess, will always be with us, but the EPA has been doing a great job. Not day to day maybe, but over the decades, our environment is a lot cleaner than it used to be. Infectious disease has not been wiped out as a category. Of course, we had COVID. COVID is not the first pandemic we've ever had, and I know it's not the last. I guarantee you it's not the last. There will be more. As human civilization pushes out into the wilderness, and encounters more and more viruses that humans have never dealt with before, we have no immunity to, then somebody somewhere in a jungle, in a desert, in a melting polar ice cap, some virus that hasn't seen humanity in the last millennia or 2 millennia will finally hop onto a human, take a ride down to the port, get on a airport, get into an airport, and land in JFK by the end of the year, and then be in a subway seat next to you that evening. So the next pandemic is coming. We can't prevent that. What we can do is be better prepared than the last time. Learn mistakes from the last time. Absolutely, mistakes were made. We could have done a better job. We as humanity could have done a better job in our response to COVID. So let's learn from our mistakes, be better prepared for the next one, because the next one's coming. Alcohol and drugs, still a problem, always a problem. Inequality will have a chapter on diversity, disparity. Disparity is when two groups have unequal share of a resource. This time it's access to health care, and the unequalness is unfair. That's what makes it a disparity. Quality food and water, definitely always a problem, and sometimes even in our country it's not guaranteed, so always have to worry about it. Okay, so healthcare costs are out of control even after attempts to keep health insurance affordable. Entire chapter is based on that, and I just checked this link. It's still accurate, it's still up to date. Middle class families can get wiped out into bankruptcy from one big bad. Everything is beautiful, living the American dream, 1.5 cars, 2.5 children, everything they want out of life, and then one big bad happens and the medical bills wipe it all out and they have to declare bankruptcy. Life expectancy. So, life expectancy is right now around 76 years old. That's average life expectancy, which means somebody born of all the people born today in the U.S., half will reach 76 and live older than that. The other half won't make it. That's what life expectancy means. It was around 78, almost 79 a couple of years ago, but it dropped, and that's because of COVID. But now that COVID is turned to a simmer, and it will eventually join the ranks of other respiratory diseases as part of the influenza season, then as science gets a better handle each time on COVID, then it'll start to the life expectancy will slowly start working their way back up again. So I've used the word health a lot, and it's time to define it. If we grabbed you in the middle of the street, stuck a microphone in your face and say, "What is health?" and you'll say something like, "Well, I guess if you feel okay, if you have no problems, I guess, if you look okay." And that was the ancient times, right? 10 fingers, 10 toes, 2 eyes, and you're good. But the absence of physical complaints is not good enough anymore, especially in our modern society and our modern understanding of disease. In fact, in the just around the middle of World War II, 1940s, the World Health Organization, which is the department under the United Nations in charge with all health matters, defined health as 3 things: physical, mental, and social. It's not just physical. So it's not just physical, and it's not just the absence of physical complaints. If I ask you how you feel and you say fine, everything all right? Yeah, it's good. Okay, you're healthy. No, that's not good enough. Maybe there's a cancer simmering under an organ somewhere. Maybe your blood pressure is through the roof, but you won't feel it. Oh, that's a problem with blood pressure and blood sugar for diabetes, is that if it's high, like very high, the patient doesn't feel it. So that causes two serious problems. First of all, the patient will not go to a doctor and say, "I feel bad," because you don't feel high blood pressure, you don't feel high blood sugar. And then the other insidious way it gets you is that because you don't feel bad and the doctor says you need to take less sodium, but there you are standing in front of a fast food restaurant and you're hungry and you're told, my doc says lower my sodium, but everything on the menu is like over 200% US recommended daily value of sodium. And then you say, I don't feel bad. The doctor's an idiot. You go inside, you get a double salt burger, and you're happy because it tastes great. But the salt is tricking you into not only it tasting great, but making you want more. Same with diabetes. You don't feel high blood sugar. So even though your doctor told you to exercise more, eat less, and to cut down on your carbs, here you are staring at a plate of pasta, and you're thinking, I feel fine. The doctor must be an idiot, and you go chow down, and the next thing you know, you're in a food coma because your blood sugar just went through the roof. So high, it's undetectable by the finger stick glucose check. And so the patient doesn't feel bad enough to go see a doctor, and they don't feel bad to reinforce any positive behavior. So how do you know you're physically okay? Well, get a regular doctor's checkup, to get blood tests, and if justified, get an x-ray. If there's a real reason, then get a CT scan. That way, things that are sneaking under the radar will finally show up on the radar. That's how you know you'll be okay. Also, the doctor who is better at detecting physical problems than you are, if at the very least get an annual checkup, then you have a better chance of catching it. The last thing you want to hear is a doctor saying, I wish you had come to see me about this earlier, because it's now too late. Mental well-being. Gradually, over the several past years, there have been more and more research reports showing that social media causes depression. It doesn't make people happier. Your mental well-being is not judged by the number of subscribers and likes you get. In fact, worrying about subs and likes even drives people into depression, into a false sense of security and social standing. But even before the internet, mental well-being was a very important part of wellness overall. But the society was not aware of it until recently. And social well-being makes sense, right? If mental well-being is important, then social well-being absolutely plays a part. Do you live in a toxic relationship? Is the boss a bully? Are you in an abusive situation at home? Then all of these things, the social aspects, will degrade your overall well-being. Do you have somebody to turn to rely on, somebody to back you up that you trust, that you can depend on? Do you have a soulmate that you finish each other's sentences kind of thing? Then that will help support you and strengthen you as you take on challenges for the rest from the other parts of your life. So social well-being is also very important, to the point where physical, mental, and social are like three legs of a chair. If you're too weak in one, if you're brittle and fractured in one, then the whole chair is going to fall over. Similarly, strengths in two of them will help support weakness in the third. So as you think about your well-being, your health, you need to make sure that you're doing things in all three areas of your life. Okay. A couple of definitions: chronic and acute. Chronic means long-term, acute means short-term. The actual cutoff, when it's acute, when it's a chronic, it changes for each department. It's different for everybody, different for every expert, but most of them will probably agree that acute is like several days to a few weeks, and chronic is several months to years. And somewhere in between, well, that depends on the expert you talk to. So, community. Here are some specific definitions. Community versus public. Community is any group that you can define, whether you live in the same place, or you like the same things, or you hang out in the same way together, or some definition, some adjective that describes you and your people, that's community. Versus public. Public is, so community is kind of like an unofficial definition. Public is an official definition. And it had other ways to define it, but today, whenever anybody says public, it means the official government division. So we're talking village, town, village, borough, city, state, nation, world. That's public. The leaders of a community are whatever you abstractly or unofficially agree amongst yourselves. The leader of a public is designated officially, whether through election or any other way, depending on what you know of, like political science. So in our country, it's by election. Okay. So public health versus community health. The public health are efforts by the political leader, mayor, governor, president, and their delegated committees to work towards the public's health. Community is the same thing, but now these are informal definitions, informal decisions to improve each other's health. Population is also even more of an abstract or unofficial, well, an abstract, arbitrary definition of a group of people. And global health is now takes it above the nation. Okay. Some more, 5 determinants of health. What makes people more healthy or less healthy? Well, how about genetics, right? Who their mommy and daddy were, like biologically their mother and father were. How they were born, never mind who their mom and dad were. What were the conditions at the moment of birth? Or just maybe even development and then birth. Was it healthy? Was the doctor competent? Or was the nurse doing the right things? Were the policies and procedures the right things to do at the moment of birth? So the difference is heredity versus congenital. Congenital is anything involving the moment of birth. Heredity are the DNA, the RNA, the genetics from your mom and dad. The physical things about you, around you, is a determinant. Social, so after all, health is social, mental, and physical as well. Your own personal choices and the kinds of medical care available to you. So that's 1, 2, 3, 4, 5. Your homework assignment is that's next time. The homework assignment is to think of a problem in your community and define it by these 5 determinants. So the next few slides are sort of like a more detailed breakdown, but I think they're pretty straightforward. Okay, organizing. So next week, in this class, we're talking about community organizing. If you want to go out, now that you know of a problem in your community, of the people close to you that you care about, and you want to do something good for them, like start a project to make the people that you care about healthier, how would you go about doing it? You can't just show up on the street corner and say, hey, everybody, I've got a great idea. Right? You got to get funds, you got to get resources, you got to organize. We'll talk about all of that next week. So 1800s, around the 1800s was when we switched from the more of a spiritual approach to healthcare and switch to a scientific approach. Because before the germ theory, nobody knew how people got sick, why people got sick. So as far as they were concerned, if everybody else was okay and you got sick, you must have made the gods angry. And from their point of view, it was the logical thing to do. Remember, they don't know everything that we know today. So very, very smart people, using the limited information available to them, what could they possibly come to? What conclusions could they reach? Well, when it was thunder, they didn't know anything about electricity. They didn't know about weather patterns. So they thought maybe the gods were talking. And if somebody suddenly got sick out of nowhere for no apparent reason, then they must have made somebody angry. So then, for a very, very smart person, what is the most logical thing to do if you conclude that you made the gods angry? Well, you should make them happy. So make sacrifices, go on quests, go do certain things to atone for your sins, and that should make you healthy. Well, then came the germ theory of disease with evidence-based medicine. So evidence-based is a phrase you'll hear all the time now in healthcare. It's don't tell me something is true because it sounds right. You have to prove to me it's true with research, and good research, not funny, fuzzy research. That's evidence-based. And for that, one example of that is the germ theory of disease, which is that germs cause disease, not something else, not the gods, not your favorite pet theory. Once we know that it's something physical, then the next logical step is, well, is there anything we can do to prevent it? And we get to disease prevention. Something I'll talk about a little bit next week is Medicare and Medicaid, which is like the current level of social engineering. What we do with Medicare and Medicaid is use some taxes. We take taxes from the general population and use it for public good, such as health care. Medicare is for the elderly, Medicaid is for people who are poor. And I talked about that already. Okay, so with public health, there are certain steps. These are almost so high level, they're almost, we need to get into deeper detail next week. But as a quick preview, there are certain steps of how to make behavior change in a community. First of all, severity and susceptibility. Severity is a fancy way of showing people how bad it is. It's not a minor thing, it's a big thing. Susceptible is a fancy SAT word for realizing that it can happen to you. How many of you know that texting and driving is bad? How many of you do it anyway? So when you do it anyway, you fail the susceptibility test. You're saying, oh yeah, texting and driving is bad. I hate it when everybody else does it. But then I just caught you doing it. Oh yeah, but it's okay if I do it. Or my eyes were off the road for only a second. Okay, you failed the susceptibility test. You didn't realize it could happen to you. Benefits versus cost is, yes, I know what you're suggesting that I do is good for me, but well, you know, it's not, it costs, there are things that I have to give up in order to do it, such as diet. I know I'm supposed to diet, but it's kind of hard because this and that reason. Cues to action are the triggers that make you do things, and self-efficacy is believing that you have the power within you to make the change you need. Almost done, and that's summed up here. I should have jumped to this slide for that explanation. Okay, so in general, when you're a public health official, you go through these steps, and the hardest step of all is the one they don't show you in the movies. In the movies, when the protagonist is a scientist or researcher, they are aware of the problem, they think about they have hypotheses about the problem, they come up with a solution, they test it, they see it works, and then the movie's over and everybody lives happily ever after. What they never show you, even after the credits, is that the hardest part of being public health official, which is convincing everybody else to do it. They came up with a vaccine. They came up with a mask mandate and the social distancing. How many people actually went with it? A lot, but not a lot. The hardest part is convincing the general public that you're right and that you should follow your advice. So anyway, this is public health, or the introduction to public health. It was nice to meet you all, and I look forward to a very rewarding and interesting semester. See you guys next week.